Good morning. My name is Trang Nguyen. I'm a board-certified geriatric pharmacist. First of all, I would like to thank you, Claire and Kathy, for giving me an opportunity to talk to you on social media. I miss talking with you and seeing you in my class or my healthy cooking demos. So I hope you stay well and healthy. For those who don't know me, I'm a pharmacist. I graduated from OU College of Pharmacy in 2008. I have been practicing as a hospital pharmacist, community pharmacist, now as a consultant pharmacist in nursing home and assisted living center. I asked Kathy what topic she want me to speak today, or what you want to hear from a pharmacist. I know and understand that you might be bombarded with lots of information about COVID-19. So we will talk about the impact of this pandemic and how we're going to keep ourselves healthy during this time. So if you watch news from CNN, you may know that they talk about the impact of the pandemic. Just throw out some numbers. In the US, 45% of people reported distress. In Canada, 47% of healthcare workers report a need for social or psychological support. In the UK, 32% report that the pandemic has made their mental health worse. In Italy or Spain, 77% of children have difficulty concentrating. 38% have nervousness and 31% feelings of loneliness. So you can see that with all the numbers thrown out, maybe you say, well, it's not me, it's not important. But if you look around you and your family, your friends, anybody you know, maybe they don't tell you, but it is a very, very important to know how this pandemic affects your healthy life and also affect your brain. So why I mentioned the brain? If some of you attended my class about healthy brain class, you may know I don't mention about mental health. I mention about the brain. So the brain health is very important. And then at the end of the presentation, I will give you some hints what you should do to improve that, because your brain controls everything in your body, and if we cannot help our brain out, we may lose control and we may lose our life. So what's the problem? Media talking about the problems of this pandemic. Why is this such a problem? Because due to the enforced lockdown or isolation, in nursing home, they don't allow visitors to visit their loved ones, or even one resident got tested positive, every other resident have to be self-isolate in their room. So we're a very social society. So with that, it's already have a big impact in our mental health. In addition to that, with a lot of young adults or even older adults losing their jobs and their income, and it makes them worry and anxiety. And with that fear and anxiety going on every single day during this time, it's make a lot of they feel like they're helpless. So, or you couldn't sleep at night because of everything going on, especially nowadays social media and news bombard you with every single day with negative news. So that may affect the mental health problems also. So the biggest challenge right now is the loneliness. That's why a lot of people lots of interest in or even have suicidal thoughts. A few months ago, a physician in New York committed suicide. After all of this going on, that really a big deal, would not just with any population, but especially healthcare workers also commit suicide. So I think it is a big challenge, and we're up to that challenge. So if you attended my health seminars, I give you examples of how certain part of the brain affect the mental health, depression, anxiety, delirium, or psychosis. So I will give you some of the supplements that, as a pharmacist, if you come into the pharmacy, and I know most of you will come and ask for vitamin C or elderberry or zinc, but I will give you more information regarding what you need to do to improve your health, keep your body healthy. So first of all, I want you to breathe deeply and breathe more fresh air. Why is that? Because our body needs oxygen, our brain needs oxygen. Drink lots of water, not just soda or beer or wine, but drink lots of water, because our brain is 75% water. So make sure you drink lots of water. So if you ask me what kind of food, what kind of supplements do you need to do to keep yourself healthy, so of course you're gonna eat more berries, and you probably already start taking elderberries or vitamin C, nuts, almond nuts, walnuts, fruit and vegetables, avocados, beets, coconut oil, and turmeric. Those things I always recommend you to think about, those things that we maybe not usually take it during the time before the pandemic, but keep yourself healthy. Our body needs nutrients. For supplements, so back to supplements, I know you take vitamin C already. So vitamin B, vitamin B complex have multiple vitamins B in there, so they are very healthy for you, give you energy, and also it prevents anemia. So as I review charts in nursing home, I have seen a lot of residents are anemic. They low in iron, they low in vitamin B12, they low in folic acid. So if you take seizure medication, you may low in folic acid. If you take stomach medication, you may low in B12, because a lot of stomach medication like Prilosec, Nexium, Protonix, that prevent the absorption of calcium, vitamin B12, or iron. So that will, over time, long-term use of those medications will make you become anemic, and you might not know that until you feel you don't feel right. You become anemic, and a lot of time doctor will just think that you low in iron, but you may low in those vitamins also. Vitamin D. Vitamin D is very important, not just with help calcium absorption, it can help with depression also. Magnesium. Magnesium is very important to control other absorption of minerals, especially calcium or insulin. So it can help. So make sure you, when you buy magnesium, don't I know it's popular choice will be magnesium oxide, but if you go and buy Slow Mag, it's a different form of magnesium. It has calcium, so in there also that help with your bones. So those are vitamins, not just vitamin C that you will think it help to prevent the infection. It's other vitamins also. So usually if you buy a vitamin B complex, it will have multiple vitamins in there that help to give you energy, that help to boost your immune system. So vitamin D, and make sure you tell your doctor to take a vitamin D level or vitamin B12 level if you go visit an annual checkup. So make sure you ask your physician about those level. Beside those vitamins, I myself also take CoQ10. If you attend my class about CoQ10, I explain two different kinds of CoQ10. Make sure you buy the ACKnack ubiquinol. So you look in the back of CoQ10 bottle, it will have a seal say ACKnack. So that's the one you should buy. That's a better absorption form of CoQ10 for you. It's usually you say, well, it's good for your cholesterol, but it's also good for your heart and your brain. So make sure you supplement yourself with CoQ10, because I know many of you are taking cholesterol medication, and over time that will lower the level of CoQ10 in your body. So make sure you supplement your body with CoQ10. Fish oil. I start recommend patient taking Lovasa, even though you don't have cholesterol problem, but fish oil with EPA and DHA is very good for your heart, but also it's good for your brain. So that will help your brain up to the optimum level. So and I start taking those. So I take CoQ10, I take fish oil, but make sure you buy fish oil as a prescription version, not the over-the-counter, because you know with over-the-counter they don't have any controls, FDA control, or any testing for those products over the counter. And I also start taking ginkgo. I know it's have drug interaction. It does have other issues with your medication, but make sure you check with your pharmacist or your physician before taking this supplement. So ginkgo will help to improve blood flow in your body and also in your brain. So anytime you have blood flow problems, then we'll have mental health problem will come out. Or why do I say that? So if you take, for example, diuretic, you take it for your edema, you take it for your blood pressure. So with diuretic, you will take a lot of water out of your body. So at the same time, it will dry up your body. So if you think about it, if you dry up your body, that means it can dry up your brain. And remember, your brain is making up water. So over time, it can cause delirium. Also, if you don't have enough water. So when you're taking a medication, another example would be Benadryl. So Benadryl will dry up you if you take it for allergy. So and one of the side effects with Benadryl would be psychosis. So, but if you think about that, it will dry you up as allergy, nasal congestion, or runny nose. It will dry up water in your brain also. So it's very important to get the water flow, blood flow in your body, so you don't have those symptoms or side effects of medication. Another supplements that I have seen nursing home residents start taking is ACKnack. It's a supplement that you can buy behind the counter or over the counter. Behind the counter, the pharmacist may have it as behind the counter, but Walmart, for example, can have over the counter. You can buy that. I start seeing nursing home residents taking those supplements for anxiety. It's a powerful antioxidant, so that will help with your liver also. So those supplements that I start taking after I learned that those can help not just for your body in general, but for your brain. So anything that you supplement with for different purposes, you always think of the brain. Is that going to affect my brain? So make sure you ask that questions when you take any supplements. So with that, also practice with gratitude. I learned that every day I wake up, say thank you. Practicing that gratitude, I found that it gives me a sense of not just a sense of loneliness, but I know that somebody is with me and protect me. So make sure you, if you've been isolated, then always keep a journal, find out something to do, and then smile often, stay positive. And I will end my presentation with a quotation that I found this morning when I wake up from Mr. Thomas Paine. I love the man who can smile in trouble, gather strength from distress, and grow brave by reflection. So with that, I hope you will have a happy Memorial Weekend, and I will see you next time when the facility open again. And if you have any questions, you can text me, email me. I know some of you already have my contact phone number, or if you can contact the Healthy Living OKC, that will have my contact phone number and my email, so you can email and ask me about questions or anything you want to know about your medication, about drug interaction, side effects. And I hope that what you learned today will help you improve yourself, especially the brain health. Remember, our brain control our body, and our brain also control our mental health. So if you keep your brain healthy, a lot of problems will improve itself. And remember to talk to your pharmacist before you take any other supplements to make sure that they not interact with your current medication. And I hope you have a wonderful day. See you next time. Thank you.